Awesome. Well, we're live here at Vegas, not Mars, but super excited at Health. We got an amazing founder, CEO, John at Gabi SmartCare. Super cool. Suzy, I think you know him just a little bit.
I do, yeah. One of my favorite founders.
And Alyssa, we're going to get a little bit of the doctor's view too, right?
We are, yeah. I've been following them for a while, so this is exciting.
Well, I'm going to step out of the way.
Oh, sure. Okay, yeah. I'd love for you to tell everybody about Gabi SmartCare and what you do. But before you do, I'll just say one thing. He's filling a very much needed gap for pediatrics.
Thank you.
So it makes him the big winner in my eyes. So with that, tell us about Gabi SmartCare.
Yeah, sure. So yeah, I'm the co-founder and CEO of the company, Gabi SmartCare. And what we do is a remote patient monitoring platform and tools exclusively for pediatrics, so for children, right? And that's the first time that happens. And basically that's coming from a need that we've seen, that I've actually experienced. Like my daughter almost got a very, very strong virus 7 days after birth, and she's been admitted to the ICU. And after a couple of weeks, she was discharged. But then physicians ask us to pay attention to specific symptoms. And honestly, we missed it. We just didn't know what to do. We felt helpless. And that's where we really experienced that need. And so that's how we decided to launch GabiSmartCare a couple of years ago.
I love it. I love it when founders build something out of a true need and something that's so close to your heart, because it means you're going to keep going with it. It means that you're passionate about it. You're not just in it to try and make money. This is something that you genuinely care about. And I've seen you guys grow over time over the last few years. I'd love it if you tell everyone a little bit about some of the use cases that you're using Gabi SmartCare for right now.
Yeah, absolutely. So, you know what? The very first thing is like we build a solution, and even before getting the FDA clearance, we got that first contact with Columbia in New York, and they were running this project, and they were in need of collecting real data from patients, and patients being children.
Yeah.
And they didn't find anything that was reliable for kids, and so they reached out to us, and actually we went through that route, which was research applications. That very first experience was great. And so we've met other hospitals that were doing the same type of project. And anyway, word to mouth, we ended up with more than 30 hospitals the very first year without even having the FDA clearance. That was awesome. That was
amazing.
That was cool. But obviously, that's not only what we want to do. What we want to do is to bring value to kids and kids that have medical needs, right?
Yeah.
So our understanding of the market is that there is definitely these very acute patients, right? The one that needs to be hospitalized. And now these patients are more and more hospitalized at home when they have the right, the right technology.
Yep.
And that's more and more seen now for the adult space, but not yet really for kids, because technology wasn't there. So there are a couple of very innovative hospitals that are doing this for some very specific conditions. Acute, probably a little bit less, but more for subacute. So these patients that, you want to discharge them from the hospital, but you want to keep an eye on them.
Yeah.
And that's actually where we started. So we have a lot of interest from hospitals, and we start working with these hospitals for cardiac conditions. So these kids that are actually born with like congenital heart defect, they need to go through several surgeries, and they need to get monitored in between just to make sure they don't get any complication. And if they have one, then we need to identify them as soon as possible. So that's one of the main conditions that we really support today. Now, everything that's chronic lung disease, chronic respiratory is another one. And a few weeks ago, we also announced an amazing partnership in sleep.
Which is fantastic.
Yeah. So we're now working with this company, Sleep Image, that is doing home sleep tests for adults, but the chief medical officer is passionate about kids, which is amazing. And they wanted to bring that technology to kids, but they didn't have any material to do that. So now we've finalized that partnership. And so we're able to serve the obese population, but also the behavioral population, right? ADHD, for example, is the kind of population that we are aiming to serve in the future.
That's fantastic. And I love the whole sleep study thing too, because there's such a shortage of availability of that for kids, especially in rural areas. And I do think if you're doing a sleep study and you're a kid, it's probably going to be more accurate if you're at home in your own environment 100%. Where you're comfortable, where you're not scared of what's going on. So I think that you're going to get better readings on that too.
That's an interesting point because, these studies that have been done on sleep tests on kids just show that only one night is probably not enough.
Yeah.
Like you need to have like 2-3 nights to really have a very good idea of what's happening in the flight.
Yeah, makes sense.
And that's my conviction, but I think also that at home, at least the child is not.
Yeah.
It's probably more at ease.
None of
more-
us like to be in that sterile hospital
Yeah.
environment. And I think it's even worse with your kid. It can be really scary. So I'm so glad that you're doing that. It's awesome.
Well,
And it's so true. And if you can't fall asleep, which is like why you're there, then you have to come back.
Yeah.
Right? And it's really disruptive. It's disruptive for the kids and the families. And so to be able to do that in the home, I think is amazing. You know that what I think you're doing is just incredible. And as a pediatric person, you know, working clinically, I'm so grateful to people like you who are focusing on the pediatric space. And I would love to see more of that. So thank you for having great technology. That's not just for older kids, also newborns too, because I think that's also a challenge when it comes to pediatric device development. And you're so right. You know, being able to do this in the home really changes the landscape because most of the kids don't live near Children's Hospital. And so there's really good data to say, if you go to a Children's Hospital, you're set. But if you need care and you go to your local facility, they're not often equipped for pediatrics. So even this notion that you can go to a place that may not take care of lots of children, you get your Gabi device, you maybe go home with that device, I think really starts to bridge the gaps and close some of our healthcare gaps, at least here in the US. So I will continue to cheer for you from the sideline.
Thank you so much. It's been very helpful so far. Yeah. Thank you.
Well, and I think when you think about social determinants of health and how you can impact that too. I mean, I remember working with a pediatric hospital a few years ago that's in kind of the Central Valley in California, and they service all the way from Bakersfield to Sacramento. And sometimes it's really hard for these kids to get to a hospital or they have to go for hours. And so anything that we can do to help bring care home to these kids, I think is super important. I mean, they're our future. They're the generation that's going to be leading the world at some point. So you've got to take care of them and keep them healthy now.
No, that's very true. That's some common thing that we hear a lot, like access to care, having to drive sometimes several hours before you reach your hospital. That's crazy.
And you mentioned in that newborn period feeling like you missed something. You know, I'll share a story that happened to me with respect to jaundice. We went home. I mean, I'm a pediatric ER doc. I should be able to tell if my own baby's yellow. 2-day checkup. And they're like, Alyssa, you know, she's glowing. I'm like, she's what? You can't see straight. So the notion that you're supposed to look out to see if your baby's turning yellow, if your baby's breathing fast, if your baby, you know, the colors change, like how are we supposed to, you know? So I think it takes also some burden off the parents that they need to take a little bit of a deep breath in those, especially early days, months, to be able to have some reassurance and then feedback it, you know, oh, I have some concrete data. Now maybe I can reach out to my provider who is an hour away from my home and actually triage appropriately without disrupting families. So
Yeah, and there's a lot of technologies out there for adults, but you're really the only one that's FDA cleared for kids age 12 for the pediatric population.
Awesome.
So, and you've got a device, but you also have the software, but you can use other devices with your software as well, correct?
Yeah, absolutely.
Yeah.
So we have this platform which is collecting these, you know, vital signs and health data from home.
Yeah.
So right now, we're actually working with our own device. The little story is that we wanted to partner with existing companies, but the reality is that we couldn't find anything that was reliable and that would cover like this kind of broad range of age, right?
Yeah.
And so we ended up building our own product. And so that's what we've done with the bracelet.
Great. I love
Now that we have that, we start having some requests from providers and hospitals to actually integrate some other devices and other things. The weight is a big one, and there's others that are only going to come through.
I love it.
Well, this has been awesome. I feel like we need to have a part 2 and a part 3. It seems like you're doing so many things within pediatrics.
Yeah, and it's exciting. I love this space. Anybody who knows, well,